Hey, this is Dr. Rachel Langley from Pine Ridge Family Medicine here in Colorado Springs at Direct Primary Care Practice, here to talk about some concussion questions that I get a lot. I feel like I've seen a lot of patients recently, whether it's from playing sports or at work getting hit in the noggin with something or getting in a car accident and having something that hit against their head and them having some residual symptoms for days afterwards. I've been seeing a lot of people with some concussion symptoms, so I wanted to go over my concussion care plan because it's not always easy for my patients to remember when they have a concussion what we talk about so that I can refer to them to this video. But also anyone out there who thinks they might have a concussion and wants to know what to do for it. Because the tricky thing about concussions, they're also called traumatic brain injuries or TBIs, same kind of idea, is that you can't just take a pill or do something fast to make things better. It's a long process, but it's worth it. The thing about when you get your brain kind of shaken up and there's some damage in there is that the brain takes time to heal, and if you don't give it time to heal right away, you might end up with the same symptoms or even more symptoms for years and years. And then it's even harder to get those symptoms to go away once they've been there for a while. You kind of have scarring inside your brain. So, how do you know if you've had a concussion or a traumatic brain injury? If you've hit your head, sometimes if you have a loss of consciousness, even just for a couple seconds, or if you don't have a loss of consciousness but you really feel shaken up afterwards, um, that could indicate that you have a concussion or a traumatic brain injury. I usually do a full cranial nerve exam when I see patients for a possible traumatic brain injury, and that's checking to make sure that the nerves that are coming directly from the brain into the face and into the even shoulder area are all still intact. Make sure there's not any signs of a bleed in your brain, which requires a CT scan to be sure about. So I do a cranial nerve exam, and then I also do balance tests and coordination tests. Things like having the patient stand with their feet together, arms across the chest, and see if you can keep your balance for about a minute, and then try closing your eyes and see if you're falling over and having a real tough time with that. That can be an indication that you might have had a concussion or a TBI. Another test that I like a lot is putting my finger up for them to touch their nose and then touch the finger. Then I move this finger, and then I have them touch their nose and finger as fast as I can. Based on how fast that was going just now, that might be an indication that I have a concussion, but it's hard to figure out this camera. Sorry. So those are just a couple of things to expect if you go to the doctor of what they might do to evaluate you for signs of a concussion. And also just talking with you about your symptoms. I mean, the basic symptoms that I usually see are things like headaches, nausea, dizziness, um, sometimes even moodiness is a common one too. And I've got a huge list of possible symptoms as well that I like patients to go through pretty much every morning while they're recovering from this concussion to see how bad those symptoms are going, whether they're getting better or worse at that level of activity. So, for example, I'll just list off a bunch of them: loss of balance, poor coordination, vision problems, blurry vision, trouble seeing, sensitivity to light, difficulty hearing, sensitivity to noise in general, numbness or tingling on parts of their body, loss of appetite, or on the other hand, increased appetite that's just unusual for them, a change in taste or in smell, poor concentration, forgetful, difficulty making decisions, slowed thinking, disorganized, trouble falling asleep, or on the other hand, staying awake. It can go either way. Feeling anxious, tense, depressed, sad, irritable, really frustrated easily. I'm reading from a sheet that I have from the Defense Centers of Excellence that I find very helpful, that I used in my military days to help diagnose concussion. It's a great resource. So I have my patients go through that every morning and evaluate how bad those symptoms are so that they can compare how they're really doing in an objective way. Some of those symptoms are very subjective, but having a whole list of them that you can compare from day to day can be really helpful. Because the way that you treat a concussion is with brain rest. I mean, the way you treat a muscle that's hurt is by resting it and then gradually returning it to activity. It's the same for your brain. So your brain's been all shuffled up, been real shaken, it has some minor damage, it needs to rest to recover. But your brain doesn't rest the same way as your muscles do. The things that make your brain work really hard in our usual lives is going to work, studying in school, things like that, and screens. Screens are very stimulating. Uh, whether it's your phone or a computer or a TV. There's a lot of information that your brain is processing. So taking a break from screens is one of the big things to do if you're recovering from a concussion. Exercise, driving, those are also big things that involve a lot of your brain. So those are also parts that fit into the puzzle of how to rest your brain. But for the first 24 hours at least after a concussion, I recommend as close to complete brain rest as you can achieve. So that usually means sitting in a kind of dark room. You can go for a walk as long as it's a pretty flat, non-exertional surface. You're really taking it easy. You're not raising your heart rate at all. Taking a lot of naps, sleeping if you can, resting. If you get really bored out of your mind and want to read something, I recommend nothing harder to read or more interesting than Harry Potter. Harry Potter is a pretty interesting book, but that's a good baseline for it. Has to be easier than that to read. So it could be pretty boring stuff to read. Sometimes I recommend tabloids or magazines or that kind of thing. Just as something kind of entertaining just to get you through the time to let your brain recover. So that's what you want to do for the first 24 hours. Then you get into stage 1 and slow progression through the stages of concussion care and slowly returning to activity. So first, you can do those slow walks at first. And then if you're handling that well, if your symptoms aren't getting worse, if they're getting better, oftentimes I see patients that have a key symptom. That's the one that they really rely on for whether they're getting better or worse. Often that's the headache. If the headache is gone, they know that they can progress to the next step. If the headache comes back, they know that they either need to take a step backwards, or if they were doing a little bit more exertional there, to back off on that one little part of it. So you're letting your symptoms guide you in your slow return to your regular life. So slowly increasing the amount of exercise until about step 4 should be about less than 90 minutes of exercise, pretty exertional exercise. But you can kind of imagine building up to that slowly. And step 4 for thinking, for using computers, using screens, studying, doing your job, less than 40 minutes at stage 4. That's a pretty slow progression. And then driving, you should really hold off until at least stage 5. Right there. And alcohol you want to abstain from until you're really back to normal. That can slow your healing process. So stage 6 is really that you're just about 100% there. You're taking one last stage just to make sure that you're 100% before you consider yourself back to normal. And that's what stage 6 is. And again, if you're not following this slow progression, there's a big chance that whatever symptoms you're having, or even more symptoms, you're going to have for years down the road, because your brain is still going to be suffering from that damage, and it's going to be even harder to get rid of it in the future. But if you have any questions on this or anything, feel free to leave a comment at the bottom of this video, or go in to see your doctor if it's a personal question, if you could benefit from an exam. Oh, I didn't mention that Tylenol is the best headache medication generally for if you're having a headache with your concussion. You should make sure that you're off of the Tylenol and your headache is still gone before you progress to the next stage, though. But thanks for watching. Hopefully you found this helpful. If you wouldn't mind subscribing there to our channel and checking out this video, because it might also be helpful for you. And I hope you're having a wonderful day.